Case 4. A 70-year-old man is admitted to the medical ward for the investigation of a heart murmur and possible pneumonia. The following specimens were collected with these results. Sputum samples showed no pus cells, numerous epithelial cells, gram-positive cocci and gram-positive rods. A blood culture was taken, and the throat swab was taken, which showed mixed growth of oral flora, including Streptococcus viridans and Streptococcus pneumoniae. Streptococcus species are gram-positive cocci facultative aerobic organisms. Both viridans and pneumoniae species are alpha hemolytic, which can be identified by the green zone surrounding the organism on the agar plate. This is also known as incomplete homolysis. Though alpha hemolytic strains of strep are usually found in the respiratory and intestinal tract, they can become pathogenic and invade certain sterile sites within the body. By doing so, they cause severe and life-threatening diseases such as endocarditis and pneumonia. Endocarditis is generally caused by the viridan species entering the bloodstream through damaged tissue in the mouth after dental procedures such as tooth removal or gingival inflammation. The organism grows on the surface of the heart valves, leading to dilation, thus causing functional deficiency. Streptococcus pneumoniae is responsible for many illnesses including infection of the lungs, pneumonia, otitis, meningitis, and sinus infections. This strep species is the most common cause of pneumonia. Strep pneumoniae is also natural flora in the body and can be found on the oropharynx, usually becoming pathogenic after the person has become ill with a viral upper respiratory infection. This leads to symptoms such as fever, stiffness, back pain, shortness of breath, and chest pain.
The patient is a 70-year-old man, therefore he would fall under the category of immunocompromised. There isn't any information of his lifestyle factors or any medical history available, which will make it difficult to ensure that the patient is able to proceed in the direction for a healthy lifestyle. However, a well-balanced diet, avoiding excessive consumption of alcohol, processed foods, and damaging habits such as smoking will be recommended. The samples provided will be able to help differentiate if the flora is pathogenic or if it is normal flora that is produced by the body. In most cases, anything that is found in the sputum or the blood cultures would definitely be considered pathogenic and would need treatment provided as soon as possible to ensure that the patient is able to recover.
Day 0. Day 0 is the day the samples will be taken directly from the patient and received by the lab. The sputum and throat swab samples will be cultured on a horse blood agar plate in both aerobic and anaerobic conditions. We will also be performing a McConkey plate. This means 3 plates in total. These plates are appropriate plates for the growth of the main suspected pathogen being Streptococcus pneumoniae, as well as many others. An optogen test would be performed directly from the sputum so we can correctly identify which Streptococcus species we are dealing with. Due to the patient being of the elderly, he will be more susceptible to pathogens such as the Haemophilus influenza. As a result of this, his sputum will also be cultured on Haemophilus agar to find out if the Haemophilus species can grow and is present. All plates will be incubated in a 37-degree environment for 24 hours. In the meantime, to find out if the patient has endocarditis due to the detection of the heart murmur, the patient's blood will be collected and cultured in 2 blood culture bottles, again aerobic and anaerobic conditions, followed by a period of 5 days incubation.
After 24 hours of incubation, the plates can be interpreted. A gram stain will be undertaken. No pus cells are present. There are numerous epithelial cells, gram-positive diplococci. GPC would also appear as draft shape, gram-positive ovoid chains, and a small amount of gram-positive rods. This identification leads us to the possible pathogen being Streptococcus pneumoniae, rather than Haemophilus, which stains gram-negative rods. However, there would be a need to confirm this by culturing the results. On the horse blood agar plates, there are 2 types of colonies growing on the sample from the sputum and throat swab. Small non-pigmented colonies would be present, as well as alpha hemolysis, and the colonies would grow better aerobically. There would be no growth on the McConkey or the Haemophilus agar plate. Therefore, there is no presence of any Haemophilus species in the patient. On the optogen test, there would be colonies. However, they would be less than the other plates. A catalase test will be performed and the results will become back as negative. Since the gram stain is a gram-positive cocci, an oxidase test will not be necessary. The sample is gram-positive cocci, sensitive to optogen and alpha hemolysis, as well as catalase negative. There is no growth on the McConkey plates, and therefore they would be identified as Streptococcus species, also known as alpha hemolytic strep. An API-20 strep strip will be used to identify the Streptococcus species. A single well-isolated colony from the HBA plate will be taken and emulsified to achieve a homogeneous bacterial suspension in a bottle of 5 ml sterile saline. The tubes and cupule for some will be filled with suspension, and some of the tests will have oil overlaying to create anaerobisis, before being covered and incubated at 36 degrees for 24 hours. The antibiotic sensitivity test can be the further identification as well as finding out the suitable antibiotics for treatment. Firstly, a Mueller-Hinton fastidious 1 agar plate will be taken, and the colonies will be collected by a sterile cotton wool swab. The swab will be dipped into a bottle of 2.5 ml saline and mixed to create a 0.5 McFarland standard. Then the strip will be swabbed evenly on the MHF 1 agar plate. The plate will then be incubated at 35 degrees with the presence of carbon dioxide in air condition for 20 hours. 24 hours of incubation, we can draw a clinical result based on the observation of the agar plate used for the sensitivity testing, as well as identifying the species present in the API 20 strep strip. The API 20 strep strip identified the pathogenic species as Strep viridans being present. For the sensitivity test, using the MHF1 agar plate, we are able to identify that the strep species is sensitive to the following: penicillin G, ampicillin, erythromycin, vancomycin, and tetracycline.
After 5 days incubation, the blood culture can be examined. Generally, the process of a blood culture can be divided into 4 steps. Firstly, collect positive bottles, which have growing bacteria. Then do gram stain to find out if they are gram-positive or gram-negative organisms, followed by subculture to figure out specific pathogens. Finally, do confirmation tests and antibiotic sensitivity tests. In this case, there are 2 positive bottles, which means there are bacteria in patient's bloodstream. The gram stains show many gram-positive cocci in chain and pair, which are Streptococcus species. The Streptococcus species which can cause endocarditis are Streptococcus viridans and Enterococcus. In some rare cases, the Streptococcus pyogenes could also cause endocarditis. To find out exact pathogen, the subculture is needed. The horse bladder agar plate with the apoptosis disc and a horse bladder agar plate with bacitracin disc are set up individually to figure out if the pathogen is Streptococcus viridans or the pyogenes. Because the Streptococcus viridans are resistant to apoptosis, so they can grow around the apoptosis disc. The Streptococcus pyogenes is sensitive to bacitracin, so they cannot grow around the bacitracin disc. The McConkey plate is also set up for testing Enterococcus, since unlike other Streptococcus, the Enterococcus can't grow on a McConkey. After 24 hours incubation, alpha hemolytic colonies are well growing on a horse bladder agar, so the Streptococcus pyogenes could be eliminated because they are beta hemolytic. Since nothing is growing on the McConkey, the Enterococcus can be eliminated as well. Checking the HBA with apoptosis disc, there is no clean zone, but the number of colonies around the disc is less than other places. So there should be 2 different bacteria: the Streptococcus viridans, which grow around apoptosis, and Streptococcus pneumonia, which is sensitive and not grow around apoptosis. The result of a colony resist to apoptosis can be confirmed the API 20 strep, which is manually Streptococcus testing or tested by automation Multitov. Also, the sensitivity test for these colonies can be done by UCAST method or the VETTEC test. The final result are these colonies are Streptococcus viridans and sensitive to penicillin, vancomycin, tetracycline, and lincosamide.
Both species, Streptococcus pneumoniae and viridans, are definitely pathogens, due to Strep pneumoniae being found in the sputum and Strep viridans being found in the blood sample. From the sensitivity test fronts, the ideal treatments would be to take antibiotics or penicillin to treat Strep pneumoniae. The patient should be non-infectious after a period of 24 hours. If there is no improvement in the patient, normally ceftriaxone, also known as Rocephin, is used to counter the illness. Similarly to treat Strep viridans, oral roxithromycin, amoxicillin, or rifampin are taken orally, while penicillin, Cefalothin or vancomycin are administered intravenously. Oh, fuck. There is a lack of previous medical history for the 70-year-old patient. He is in the elderly age range, which means he is more susceptible to pathogens and that there is a high risk of infections in general. However, there is little information about his lifestyle factors. Information such as his diet or habits, i.e. whether he smokes or consumes alcohol, is not readily available. Therefore, it is difficult to continue the discussion of further direction. Once the patient has fully recovered from both strep pneumonia and strep viridans, a vaccine should be administered. There are two types of vaccinations, 13-valent and 23-valent, which has 13 or 23 different strains of pneumonia available.